Hello, good evening. Recently, during my OPT day, there was a 12-year-old girl reported to the department with a swelling in the floor of the mouth, and provisionally it was diagnosed as a ranula because of its appearance, which is grayish to bluish discoloration of the mucous membrane with the cystic cavity, which appears on the lateral to the midline anterior floor of the mouth below the tongue. The swelling was painless, fluctuant, and non-pitting, and she gives the history of there is no increase in the cystic cavity during the meal time, and we given appointment for that 12-year-old girl. In between the appointment schedule, it got burst. And differential diagnoses are lipoma, epidermoid cyst, dermoid cyst, and Ludwig's angina also we can call in case of that plunging ranula. If it's a plunging ranula, the differential diagnosis is submandibular and sublingual space infection, which leads to cellulitis, we can say. And the treatment plan for that case is incision and drainage and marsupialization, and some authors suggest, especially for children's or kids, minimally invasive technique, that is suturing of the crust of the cystic cavity and the allowing that cystic cavity to drain instead of opening or incisioning that cystic cavity. This is the minimally invasive technique, just suturing the crust of the cystic cavity. Recurrence rate is less for the marsupialization along with the removal of the gland as compared to marsupialization and incision and drainage. Today we are going to discuss mucocele. What is mucocele? It's nothing but there is accumulation of the saliva or pooling of the saliva due to the obstruction or trauma to the salivary gland duct. There are two types of mucocele, which are mucus extravasation type and mucus retention type, and another form which is the special type of mucocele, that is called as the ranula. The ranula, it's on the debate due to its mucus extravasation or mucus retention type. Now coming to the mucus extravasation type, there is a trauma to the salivary gland duct. Due to the trauma, the accumulation of the mucin into the connective tissue, which it has no definitive epithelial lining. This is called as the mucus extravasation type of the mucocele. And another mucus retention type, it is due to the obstruction of the salivary duct, and there is a accumulation or pooling of the mucin or saliva, and it has the epithelial lining. Now coming to the special type of the mucocele, that is the ranula. The name ranula came because it appears like a frog belly, which is the grayish or greenish discoloration of the mucous membrane exactly appears like a frog belly. It is ranula is some authors suggest it is a mucus retention type, and some authors suggest it is a mucus extravasation type. It is on the debate actually. Ranula is a soft, fluctuant, movable swelling which located lateral to the midline, and some bigger ranulas elevated the tongue and leads to the obstruction of the airway also. If the ranula pierces the mylohyoid and appears on the neck, it is called as a plunging ranula. This mucocele and ranula cause difficulty in speech and swallowing, and sometimes airway obstruction also. And the treatment for this incision and drainage for the smaller size, and some bigger size incision, drainage, and sometimes marsupialization along with the removal of the gland also. Now we will discuss marsupialization. Marsupialization is nothing but it is the incision and incision of the cystic wall anteriorly and superiorly, and attachment of the cystic wall to the normal mucous membrane wall.